Causes and impacts of homelessness. Causal factors for homelessness are synonymous with causal factors for poverty and include, but are not limited to, the following: lack of access to affordable housing, lack of sufficient income, including unemployment, lack of access to mental health services, lack of access to substance abuse services, domestic abuse and violence, and natural and other disasters. Domestic violence continues as the leading cause of homelessness for women. In 2013, 36,348 people nationwide reportedly received emergency shelter or transitional housing from domestic abuse programs within a 24-hour period. Similarly, family violence, abuse, and neglect are the leading causes of homelessness among school-aged youth. Homelessness has a devastating impact on young children and families. Children without a permanent home are at a higher risk for poverty-related issues, including inconsistent and inadequate health care, health needs twice the rate of other children, inadequate nutrition and access to food, crowded, often unsanitary living conditions, lack of appropriate learning tools available to children, as well as limited access to early childhood programming and waiting lists. The social-emotional impact for young children without a home is important to understand, as young children experiencing homelessness often lack familiar and predictable surroundings, which impedes the child's ability to form attachment with adults and friendships with peers. Research shows that homelessness can cause emotional stress and trauma for young children, including anxiety, fear, self-doubt, and attachment disorders. The impact of homelessness on babies, toddlers, and preschoolers is significant to note because this population is more likely to be born prematurely, less likely to have well baby visits, less likely to be breastfed by their mothers, more likely to be exposed to violence, more likely to have chronic health conditions, and more likely to have mothers with mental health struggles and more likely to have social-emotional delays. Barriers to early care and education. Families with young children experiencing homelessness may have significant barriers to obtaining child care assistance due to an inability to provide required documents, transportation, and gaining access to child care facilities. Homelessness has a greater impact on young children in rural areas as compared to urban settings due to a lack of access to community services and supports. Families in both settings are supported by the following: faith-based organizations, health departments, school social workers or liaisons, and medical providers.